All right, guys, it's 1:31, and we're going to go ahead and get started. We're going to start with welcome to the webinar. It is a kind of a one-on-one for Medicaid to give you an idea on how to help consumers when they come to you and they need Medicaid or have Medicaid questions and where you can go to get those answers. I also have Jennifer Michaels here with me. Say hi, Jennifer.
Hello, everyone.
And she'll be going over some Medicare Ohio stuff and a little bit more of a deep dive into the Medicare side of the fence. So I'll stay with the under 65 side, and she'll get us over to the Medicare side. All right, so next slide. Again, my name is Trina Shaw. I'm a licensed health insurance agent with Cornerstone/ARC/Risk Strategies. I've been here for 9 years. Previously, I worked as a third-party claims administrator in the claims department, a couple of years with Humana Pharmacy, and I worked for Job and Family Services for 10 years. And then a little bio thing there that says I'm passionate about simplifying health insurance for my clients and finding plans that work for them. Underneath me is Jennifer Michaels, and she's a representative from Molina Healthcare. All right, and that's Jennifer's information there if you wanted to jot that down. Today's agenda, we'll be talking a little bit about the changes of Medicaid, what is Medicaid, Medicaid basics, Medicaid eligibility, Ohio Medicaid services and programs, Medicare premium assistance programs, non-emergency transportation, also known as NET, how to apply for Medicaid, and then, again, of course, at the end, some next generation MyCare program overview and some Q&A. All right, for the upcoming changes to Medicare, we will not be going over those just because most of those changes will not go into effect until 2027. But also, local policy has not yet been written to implement those changes out on their website or release them to the public. And I don't want to give misinformation because between now and the time they're implemented, there can be quite a few changes. So you'll be able to get that information at a later time, but I'll tell you where to get it from. What is Medicaid? This is straight from the Medicaid website. Medicaid is a joint federal and state program that helps cover medical costs for some people with limited income and resources. The federal government has general rules that all state Medicaid programs must follow, but each state runs its own program. Also, each county has their own division. So even though it's a state-based program, it's administered by each particular county. So we're in Hamilton County. Hamilton County is only going to do Hamilton County residents. And then at the end, but each state runs its own program. This means eligibility requirements and benefits may vary from state to state. Medicaid Basics. This program is designed to safeguard the health and well-being of the county residents, particularly the vulnerable population, including children, pregnant women, elderly, and individuals with disabilities. Medicaid may pay for part of the cost of visits to the doctor, hospital expenses, nursing home care, home health care, and in some cases, transportation. Medicaid and Medicare eligibility. You will not lose Medicaid eligibility when you become entitled to Medicare in some cases. As long as your income falls under the limits of Medicaid eligibility in the state, you will receive both types of coverage. Dual eligible, basically. Individuals who qualify for both Medicare and Medicaid at the same time. The Children's Health Insurance Program, also known as CHIP, provides low-cost health coverage to children and pregnant women and families that earn too much money to qualify for Medicaid. So there's different buckets of Medicaid. I know that sounded confusing, but there's probably about 20 to 30 different Medicaid programs under a federal block grant. Medicaid eligibility must be a U.S. citizen or those who meet the Medicaid non-citizen requirements. For more information on that non-citizen requirement, if you go to your county website, it'll go a little bit more in depth. Sometimes you have to call the county agency to get more information on that. Individuals with low income in 2025 for Hamilton County only, it looks about 20K or under, you'd be eligible for Medicaid. For other counties, that number can change. Pregnant women, infants, and children may be eligible, older adults may be eligible, and individuals with disabilities. To be eligible for Medicaid coverage in Ohio, you must be a United States citizen or meet Medicaid citizenship requirements, have or get a Social Security number, be an Ohio resident, and meet financial requirements. Ohio Medicaid services and programs. Some common services available under Medicaid is preventative care, pregnancy-related services and family planning, behavioral health, emergency services, dental and vision, prescriptions, private duty nursing. Just a few programs available to Medicaid recipients in Ohio. Healthy Start provides health care coverage for children under the age of 19 and pregnant women who qualify based on income. Healthy Families provides health care coverage for the entire family. Health Check, also Ohio's early and periodic screening, diagnosis, and treatments. EPSDT benefit for all Medicaid recipients under the age of 21. A lot of that includes like their preventative shots for schools, though sometimes they'll have individuals that they'll have a program where they'll go out to the homes to give those shots. Sometimes at the school, the nurses are able to give those preventative shots as well. Look back at it. Medicare Premium Assistance Program, MPAP. MPAP helps Ohioans pay the cost of the Medicare premiums, deductibles, coinsurance, and co-payments. Eligibility requirements: be eligible for Medicare age 65 or older, certain disabled people under 65 or people under age 65 with end-stage renal disease. Be a U.S. citizen or meet the Medicaid citizenship requirement. See county website for details. Be an Ohio resident, have or get a Social Security number, meet certain financial requirements. When applying for MPAP, you will need to provide proof of income, resources, age, disability, citizenship, if not a U.S. citizen, and additional insurance information. Non-emergency transportation. This is a benefit I wanted to highlight because a lot of people don't know about this benefit, but children that are in certain behavioral schools or children that have conditions like ADHD, ADD, there is a transportation program that will transport them from their home to and from school. It's a statewide program administered by the county's Job and Family Services that provide non-emergency transportation to and from the Medicaid provider. This one, transportation authorization may be in the form of a bus pass, van services, access tickets, or mileage reimbursement. This is all for all Medicaid individuals, but for the one for school, it would be van transportation. The net request must be submitted 5 days before transportation is needed. Net for children in behavioral schools, Kids Thrive is one of the ones in Hamilton County. Provides transportation to and from school, long-term care facility transportation, ambulance and ambulette transportation, hospice transportation. Requirements: must be able to transfer from wheelchair to vehicle independently. Wheelchair must be easily folded and stored. Must have a regular Medicaid card. How to use NET, Medicaid beneficiaries in Ohio. For Hamilton County, the number is 513-946-1000, or they can submit a non-emergency transportation request form. Usually if you call the 946-1000 for Hamilton County, they'll direct you from there. But again, refer to the website. How to apply for Medicaid. So there are several different ways to apply for Medicaid. One thing to keep in mind is for Medicaid, you do not need a face-to-face appointment. So you can apply online at www.benefits.ohio.gov. You can call the Job and Family Services in your county to request an application. For Hamilton County, that number is 513-946-1000. You can print an application from your county's Job and Family Services website. You can upload that same application to in this case, Hamilton County Job and Family Services.org. On the application, you can be asked a series of questions and then be guided to this is on the website. On the application, you will be asked a series of questions and then guided to the self-service portal where you will recreate a profile and submit the application. If your income is above 205% of the federal poverty guideline level, you will be directed to the marketplace to apply. And then you can check your county Job and Family Services website for further income qualifications. If you print the application and you can mail your completed application in Hamilton County, it would be 222 East Central Parkway, Cincinnati, Ohio, 45202. Also, if you visit your local library, they can help you print out the application and fax the application to the county agency. And that is it for my portion. I'm going to move out this way so that Jennifer can start her part of the presentation.
Thanks, everyone. We're going to talk about the MyCare Ohio program. That program has been in existence for about 10 years currently, but it is getting ready to have a little bit of an overhaul, and it's going to be what's now referred to on this slide as the next generation MyCare program. So I just kind of wanted to go over some of the changes, when things are rolling out, and what it actually means. So let's just talk first about the program overview. So MyCare Ohio integrates, you heard Trina talk about Medicaid. So for individuals that are 65 and older or under 65 with certain disabilities that qualify for Medicare benefits, based on their income, they can also have Medicaid. So MyCare Ohio integrates individuals with Medicare and Medicaid benefits into one program. So it's kind of managing, it's a coordinated managed care plan. So what does that do? That gives one point of contact, one care coordinator for both of those benefits, one organization that handles both of those benefits, streamlining the communication so you're not getting multiple, or so a member is not getting multiple communications from different carriers. And it also helps if you have a claim that has been denied, you only have one point of contact to go and file an appeal for that claim. So the goals really for the next generation of MyCare you see here are to focus on the individual, to streamline and make healthcare less complicated. So we want to improve the individual and population wellness and health outcomes, create a personalized care experience with care management, it helps support the providers, so the doctors and hospitals, in continuously improving care, and approve care for individuals with complex needs that would promote independency within the community. Also to increase program transparency and accountability. So you can see here, one care manager to handle everything. On the Medicare side, the carrier will help you plan and schedule appointments, help you understand diagnosis and illness by that care management, connect members to community resources if there are needs that a member has. Also making sure that members have the medications and supplies that they need, and understanding the healthcare benefits and what services are covered within the healthcare policies. So current members, today through the end of this year, you will see the name MyCare Ohio. That's the current name of the program. So again, this is for members that are enrolled and eligible for both Medicare and Medicaid services. Right now, it is for individuals that are 18 and older, but you must reside in one of the 29 counties. In the next map, I'll show you what that current footprint is. The next generation of MyCare will begin January 1, and again, it's for those individuals that are Medicare and Medicaid eligible. However, they're moving the age back a little bit, so they must be individuals that are age 21 and older on Medicare and on Medicaid, so 21 and older with certain disabilities. In the beginning, for January 1, you would reside in one of the 29 counties. However, throughout the calendar year of 2022, they will begin adding additional counties to the program so that by August 1st of 2026, all counties in Ohio will be eligible for the next generation MyCare program. So this map shows you the current 29 counties. So you can see down here, we're in Southwest Ohio. So we have Hamilton, Claremont, Butler, Warren, and Clinton County, I think that is, or Highland County. Yeah, in the 29 counties. Then you can see a couple counties around Dayton, around Columbus, around the Toledo area, and then the Cleveland and Youngstown area. These currently listed here, the MyCare plans are divided by regions and what carriers cover those regions. So you can see down here in the Southwest, the carriers that cover the MyCare Ohio plan are Aetna and Molina. Those carriers will go through the end of 2025, and then we'll talk about what happens in January of 2026. So your eligibility for the MyCare Ohio waiver. So the waiver is a program within Medicaid that people that need nursing facility level care can get on a waiver program that will help them stay at home for longer. So this will still be part of the program moving forward. You have to be enrolled in the MyCare Ohio program at the time that you're applying for the waiver, and you must meet, it must be determined that you need nursing facility-based level of care. So you either need intermediate or skilled care at a nursing home. It would require hospitalization or nursing facility services to meet needs, and you have to have at least one waiver service, so a home health care provider or a care coordinated provider that's helping you with your care. So let's talk about the impact on this next generation of MyCare Ohio. So currently, individuals that are on the MyCare Ohio plan, this next generation implementation does not have immediate impact. So if you currently are on a MyCare Ohio plan, you will continue to receive services through the next generation MyCare plan beginning in January of 2026, and you will not lose any benefits under that MyCare Ohio plan, like I said, as it rolls into the next generation. However, if currently, like I said, down here in Southwest Ohio, we have Aetna, and then in Northeast Ohio, United Healthcare does also have a MyCare Ohio plan. Members that are enrolled in those two carriers' plans, Aetna Better Health of Ohio or United Healthcare Community Plan, those services, they will need to pick a new Medicaid provider under the next generation MyCare. So, but if you currently have Buckeye, CareSource, or Molina, the Medicaid part, there will be no disruption on the Medicaid part for you. So let me just go to the next slide. So these four carriers that you see here listed in the box are the providers moving forward that have the state Medicaid contracts. So Anthem Blue Cross and Blue Shield, Buckeye Health Plan, CareSource, and Molina Healthcare of Ohio. So the Aetna and United Healthcare did not win Medicaid contracts with the state of Ohio. So for Medicaid, beginning 2026, January 1, your Medicaid will be provided through one of these four carriers. So here's the landscape of how moving through 2026, the MyCare Ohio, next generation MyCare Ohio will work. The gray counties that you see on this map are the current 29 counties that are in the MyCare Ohio as of today. So those counties will be looking at selecting new plans for January 1 in those counties, those gray counties. Then beginning April 1, you can see there's not quite 10 counties that are in kind of a dark blue color. They will be adding those counties in April 1st. So those individuals will then have the availability for the next generation care plans. May adds the light blue, June adds the orange, which is in that south kind of central area. July has just below Youngstown there in that green, and then August 1st you have those additional counties that are butting up against West Virginia. So they're doing a graded rollout, sliding rollout to get all of the counties. So by April 1st, all counties will now have access to the next generation MyCare plans, which are those four carriers that I just showed you. So let's talk about, okay. So next generation, so transition plan. Now that the MyCare Ohio plans have been announced, they are still kind of developing those plans. We will have plan information available October 1st that we will be able to provide to individuals with Medicare and Medicaid plans. So there are resources out here under the Ohio Department of Medicaid. There is a frequently asked questions section that you can go to. There are several one-page documents out there that you can look at. You can also look at questions, get answers to questions about passport, and if individuals are in an assisted living facility as well. There is some provider information out there as well for providers to go out and look at this as well. Really what the state is moving towards with the next generation of MyCare is having one carrier that is for both your Medicaid services and your Medicare services. When you have your Medicare services with a different carrier, there's not a coordination of benefits that happens, and so you also could be missing out on some services that are available through Medicaid here in the state. So just want to let you know they're moving to this integrated care where you have the 4 carriers that will have integration with Medicaid very closely, giving members access to the highest level of care. So that is the end of my part of the presentation. Thank you so much for listening.